Dr. Handa, we were speaking sometime earlier on. Could you describe for us the tsunami of cases coming into the ER in your hospital, Mulchand?
Yeah, we have had literally a tsunami of cases, and I'd said that though we have increased beds over the last 1 week or 10 days, we still have a waiting list of about 50, 60. I mean, that's what we keep on telling. Please give us your name. We will put you on the waiting list and we will let you know as soon as any patient gets discharged. The government has come out with the discharge policies also, and we are following those discharge policies. But we still have, one patient gets discharged and the two patients are waiting to get into that bed. Plus, we have converted all our single rooms to double rooms. There are no single rooms, and we request, because many patients want single rooms, but we request them, we do not have single rooms. We have converted all single rooms into double rooms.
Dr. Handa, could you tell us what your doctors and your nursing staff are going through on a 24-hour basis?
Yes, a lot of doctors have opted for that. They have personally come up. These are the resident doctors who have had done COVID duties throughout the year, during the last wave also. They themselves have come out that we will do 24 hours. I mean, that's very appreciable of them. I mean, they have said we can do 24 hours duty because we have shortage of manpower also now. And healthcare workers are also getting infected. So that leads to another reduction in the manpower. So everybody has to manage somehow, and I think everybody is pitching in and doing their bit, even doing 24 hours duties if they have to do 24. You can imagine a doctor wearing a PPE for 24 hours. We advise them to, after 8 hours or 6 hours, to go out again and refresh themselves and come back again. We change your PPEs and come back again. But yes, they are doing 24 hours straight duties.
Dr. Handa, therefore, based on what Dr. Trika has said, how important is it to have vaccinations? Because this is another thing that has happened. In the last couple of days, the number of people vaccinating in, let's say, Delhi has not been at the number which perhaps it should be. And what a lot of doctors say is that the vaccine helps you to build up antibodies. And therefore, the chance of this becoming more serious or possibly requiring hospitalization goes down. Is that something, firstly, am I right in that?
The vaccinations do not prevent you from having the infection. They will prevent you from the severity of the disease. That is what, I mean, you cannot, you will transmit the disease and you will get infected. The vaccine does not prevent that. The vaccine only prevents, the vaccine only prevents you from having a severe form of the disease. That is the only thing. And I think that is the only preventive sort of shot or preventive vaccine or preventive medicine that we have at the moment. But other choice do we have? So vaccination is mandatory. It should be mandatory. At the moment it's voluntary. I think the government should make it mandatory for everybody to have a vaccine. And vaccine hesitancy was there, but now since the surge is there, there is sudden demand for the vaccine because everybody wants a vaccine. So now there is a sudden shortage of vaccine. Otherwise, I mean, the vaccines are there.